Assalamu alaikum. Welcome everyone, especially for the applicants and for the panelists. Thank you for joining us. And I like to start. And first, I'd like to congratulate all of the applicants for coming so far. Obviously, coming so far in the pathway of application, then that does show your dedication to hard work and everything. But now, I would say this is also the most exciting and most important part of your journey, where you have to apply, and then that's why we decided to do a couple of seminars to go ahead with guiding you guys on the basics of personal statements, CVs, interviews, and all of that stuff. I'd like to introduce our panelists today. Most of you guys know Dr. Irfan Munir and Dr. Asem Ilahi, who are our chief guests today. Dr. Irfan Munir is a nephrologist down in Fort Wayne, Indiana, and Dr. Asim Ilahi is a program director down in Dallas. We have a couple of residents who just did this procedure last year. Dr. Josefa Khan Niazi, who's a PGY2 now, Dr. Abdul Sabur, and Dr. Hassan Ilyas, who is a hospitalist in Fort Wayne, and Dr. Hafizul Hassan Work. Obviously, he's the chairman of our KEMCAANA YPC. My name is Usman. I'm a third year resident at Geisinger. So that's pretty much about the panelist. How the agenda for the talk today is that we do have set questions that we're going to ask these panelists, some of the burning questions that we get every year as a reviewer of personal statements or going through Facebook or things like those. Once those questions are done, everyone is welcome to ask their questions. Meanwhile, if you do have certain questions that you feel like that it's not going to be time at the end, you can text those in the chat box, and Dr. Rafi's work and hopefully Yusuf and Hassan will be helping us with those answers. So that being said, I'm going to start with Dr. Irfan Munir, starting with a couple of questions. Dr. Munir, thank you for joining us. The panel's first question for you was, what do you think is is a standard personal statement that really stands out from an average one? Like if you are to see 10, 20, 30 personal statements, what are some of the things that you would keep in your mind, like, oh, this guy really wrote something? What are those things?
The main thing, the main object, content when we're looking at the personal statement is it should be coming out of your heart. So right now, a lot of people are using ChatGPT, and those statements are very easy to tease out from the real personal statement. So a personal statement should have a very catchy opening paragraph. There should be personal stories supporting everything what you're going to say in subsequent few paragraphs. So as you all know that the first statement normally you call as a hook statement. We try to catch the heart and the eye of the reader, and then things like what brought you in your in medicine, supported by life story. What do you want to do? What you want to do? Again, supported by a personal life story. Uh, and why do you want to go to a particular program? There should be a solid grounds for it. So these are the few things which we like to see. I mean, it does not have to be written in a very good English, very articulate English at times, but as long as you are conveying the message and it's coming from your heart, that's what we're looking for. And one of the things which I always look for is personality as well as a personal statement is the resilience. How can you withstand the pressure, and how would you how your previous life would make us believe that you have gone through the hardship and you've gone through it and you've done well and you've succeeded. So these are the few things I think I'll just stop in here and let's carry on the discussion, and then in the end I'd like to conclude the session as well with some initial comments.
Okay. Thank you. Thank you so much. I do agree on these things, especially with resilience, since we're coming from a different medical background, medical training. And then people really want to see if you can go through that hard work of residency, if they can count on you during those nights, ICU rotations, and all of those. So I do agree on the resilience part, 100%. I'm going to move to Dr. Hassan Ilyas. Uh, we wanted especially your opinions on the things like what are some of the mistakes that you see people are making every year in their personal statements, especially some of the stereotypes that they are following for the personal statements?
Yes, I would say like coming as IMGs, we start to like see a trend in the IMGs personal statements a lot of the times is like starting opening with the personal family illness. Everyone either has like someone having a seizure disorder, someone heart failure, something like that. And then coming from that, oh, and that was my point where I started medicine. The other thing is that is one of the topmost. The second one I would say is like writing your CV in the post form, like whatever you have already mentioned in your CV, putting that into your personal statement. Third thing is not showing about yourself. Tell a story about yourself, what you like, what has made you come so far, and what is driving you. That kind of things are missing from our personal statements. Having trained in a residency program where the most of the residents were AMGs, I would say there is a lot of difference between their personal statements and ours, and having discussed with them as well. So I would say these three things that we our people especially can work on to shine in the match process.
Yeah. Thank you. To agree on that. Like, if I'm going to review 10 personal statements, eight of them are going to start with a personal illness or someone, everyone coming from a village, or those two are like the most big things that we keep seeing every year and then keep mentioning to people to avoid those. Thank you. I'm going to move to Dr. Zephyr Khan. Our question for today was like, especially you just recently applied for the match last year. Like, how did you started? Like, if we have a lot of applicants who probably have not started working on their personal statement since it's July, and even I remember when I was applying for the match, like, oh, you can work on during your last 10 days of application, just focus on your step three. Like, how did you started? When would you say is an ideal timeline to start working on the personal statement? And if I'm applying for the match and I'm just working on my step three, how much time should I be giving it? How I should be writing those notes? And if you can share with us a structure of how to go over those things.
Uh, so one of the foremost important thing is you shouldn't wait to write personal statement till the last moment. Uh, like if the match deadline is 23rd September, you don't start writing it just a week before. Today is 25th July. You should have your first draft by now. Then when you write your first draft, you should leave it alone for a few days, let ideas flow naturally, and then make modifications accordingly. And then it is good to send your personal statement to different people to get it reviewed, to incorporate different opinions, but this shouldn't be overly done. You shouldn't incorporate every suggestion into your personal statement. And then normally whatever your first draft is, that is never your end personal statement. It goes through multiple revisions. Like if I talk about my experience, I started working on my personal statement by the end of June when I was doing my USCs. And by the time of September, it was completely different. My last draft was completely different from my first draft. And then when you design your personal statement, just make sure there should be a continuous story. When you jump from one paragraph to another, this shouldn't be like the story now has completely shifted, or the all paragraphs should be connected with each other. And how I designed my personal statement was the first paragraph, why medicine? The second paragraph, why this specialty? If I'm going for internal medicine, why internal medicine? Then the third paragraph, who am I beyond medicine? What are my hobbies? Why do I want to pursue the US healthcare system? And the final paragraph, combining the whole story together.
Okay, thank you. Yeah, I agree on that. Starting as soon as possible. We do have someone who has reviewed, I would say, like not hundreds, thousands of personal statement every year since he's the program director. And Dr. Ilahi, can you hear us?
Yes, I can hear you. Can you hear
Yeah,
me?
thank you. Yeah, we can hear you. We have a couple of burning and bold questions for you. And one of those questions was like, how much weightage do you give to a personal statement beyond scores, beyond their CV? If you really like someone personal statement, like, would you really interview them? And the second thing was, since you are reviewing a lot of personal statements every year, what are some of the things that you really see that you can advise the applicants to follow on?
I think out of 100, only two or three are something which can, change your decision based on pure personal statement. Otherwise, as you said, they're all the same. They start with a personal illness and they end with that okay, I like US system so much. There's nothing in there. And to answer your second question, weightage, I mean, as long as you don't mess it up, as long as it doesn't look like a AI generated or something really similar to what I've seen for last, like, 10 years, it should be okay. But there are very few who have, some content which will make you say, hey, I want to see this guy, or girl. I thank you.
Thank you. And one other thing, since you were mentioning
Mhm.
about the personal illnesses, like
Mhm.
how would you like if you have to tell a couple of our people like how to avoid those resonation of those stories, like most of the people, especially coming from IMGs, especially coming from Pakistan, they would ultimately fall into those three categories, so how should they be avoiding it?
It's a good question, but I don't have the answer to it. I think it's just like as Josefa said, you have to think a couple of times and write it first as a draft and then let your thought process flow again and think again and see if you can think out of the box of personal illnesses. If I write my personal statement, it's gonna again start with I saw my father or my mother being doctors, but that's not the right way because everybody's writing it. It was a right way when I was writing my personal statement, that it had like some individual. But I think if you stop looking at what's present on the forums and you start creating your own thing, you may be successful. Other thing I would advise it, please send it to your mentor because he's a neutral person who's looking at it and he can make few changes and it will look like an individualized person statement rather than like a generic person statement.
Thank you. And one other question that we really wanted to ask you was about, since we do see a lot of visa issues every year, and then people going through hardships and all of that concerns with that. Like, would you advise applicants if they have had any kind of hardships in their life, probably could be immigration, visas, all of those things, or any challenge that they had faced, would you advise them to write on that? And if yes, like how much they should be framing those things and how they should be framing those things in the personal statement?
I would not. It's again my personal opinion. I may be wrong. If I see some hardship there, it's because of all these things which is going on right now. It's gonna put a pressure on me that there will be two pressure. One that I'll have a soft corner that hey, this guy went through hardship. I need to help him. The other thing, okay, what if it happens again? He doesn't get a visa. I'll be waiting for him for next 3-4 months. Then I have to hire somebody, off cycle or in a rush. So these kind of visa hardships I would not mention.
Thank you.
Thank you.
And gonna go to Dr. Amna. I think she's with us. And
Yes, thank you so much, Usman.
yeah,
So,
thank you,
my
Dr.
two cents. Number one is your CV. When you are writing some things in your CV, do not put it in your personal statement, right? It should be different than your CV. CV is telling you about your professional journey, but at the same time, do not make your personal statement your biography. Like I was like 6 years old and then I saw my grandmother had tumor or cancer and that influenced me, or I was like in medical school, or I was about to choose my specialty and then she had tumor and then I thought I'll be like, I'll become oncologist. Basically it should be something meaningful, right? All of us at some point in life have seen these things happening, and this does not stand us out from other individuals. It's like very common. Your grandparents might, have heart failure or diabetes or whatever and whatnot. That should not be the center of your personal statement. It's not your biography. It is your meaningful experience, how it shaped, yourself to be what you are right now. Maybe maybe start with some meaningful patient encounter. Like I previously, or actually these days, I'm mentoring a student from Pakistan. She's actually a graduate, and she came up with the thing that she wants to switch the subspecialty, and she was OBGYN in Pakistan, and now she wants to be in pathology. So I'm trying to like, and she's very like, skeptical, like, can she do it or not? And then I said, like, why do you want to switch? Tell me something that will make you stand out, right? Like any experience in during your OBGYN fellowship, or during your OBGYN subspecialty. And she came up with a very nice example that the patient had a pelvic mass, and she was young, and when operation was done, and this is just an example, right, when the surgery was done, the tumor was sent to pathology called it like teratoma. So basically they were very scared that it could be like a very malignant, like highly malignant tumor, but that was not the case, right? She had teratoma, which is not as bad as like serous tumor or anything. So like she was very impressed. She's like, wow, pathology can change the course of treatment. So I'm like, use this example that you are going to switch your subspecialty from OBGYN to pathology because you're impressed. Now, how we at the background can change the management. So these are certain stories that can help your personal statement stand out, becomes very unique. Your statement will become very unique, and the reader will say, oh my God, this is like a somebody who's really dedicated to this subspecialty. So basically, it is not your biography, it is your experience that is going to shape your future. And it should not be similar to your CV. It should be different, and yet it is highlighting you and separating you from other candidates. Thank you.
Thank you. Thank you. And just gonna go back to Dr. Khan, Zafar Khan again. Uh, Since you were mentioning this about how you were framing your personal statement, like, would you share with the applicants, like, if you had any thoughts about how many pages you were gonna write, or if you had a number of like certain words, like for example, if you were gonna write like 500 words, 600 words, because we already, like, as an IMG, we are following up on certain guidelines or certain numbers or certain rules, so that if I'm writing my personal statement, I want to make sure that, oh, I'm making sure that it's not too lengthy, it's not too small, like those things.
Hmm. Of course. So your personal statement should be around a page, which includes around 650 something words, but it should never exceed beyond 1.5 page. The reader will lose attention midway and it won't be beneficial writing all of those. Then your opening paragraph is the most crucial one, which catches the reader's attention. So just as Dr. Lahis, Dr. Qureshi mentioned about this, it shouldn't be just like, I wanted to be a doctor from childhood, or there was this family medical illness and I wanted to pursue this. Like 99% people would be writing this. The meaningful patient experience, any meaningful patient experience, any patient encounter that really change your perspective. If you start with this paragraph, that can be very strong. Then it should flow naturally into the second paragraph about the specialty you want to pursue. And there should always be a continuous story. Even if it is like one page, if it flows naturally, it is going to be very strong.
Okay. Thank you. That really helps, especially like if I'm starting my personal statement today, like if I have certain numbers or things in my mind, then I can start working that way, that I have to write a minimum of 600 words or a paragraph or things like those. Just moving on to Dr. Hassan Ilyas, this is a question that even when I was applying, I had asked a couple of people, since as IMGs, we are probably applying into 100 or 120, 150 programs. How should we tackle that? Like, do need to write like a personalized paragraph for all the programs that I'm applying, or for just write a simple personal statement, send it to all the programs? Or should I write a minimally a dedicated paragraph for the programs I'm signaling? I believe the number is like 15 or 20 today. How should I tackle that?
So regarding that, like especially with the since the signals were introduced, I would highly recommend to everyone like always personalize the personal statement for the programs that you're signaling, especially your gold programs, your silver programs. places where you have done your observerships, put an extra effort into it, because the chances of getting interviews from the seasonal programs is the highest that you're gonna get. Outside that, then you can look like, especially like if you have done multiple rotations in the same area, then you can also make small adjustments in the last paragraph of the personal statement for applying to the programs in that area. But not all, if you're applying like 100 programs, individualizing for every single program is not very feasible or like very high yield as well. But doing it for the gold and the silver programs, and maybe some areas, or maybe you have a like a desirable location, you have a family who lives there, so I would recommend individualizing the personal statements for those programs.
Okay, thank you. Yeah, I really would like to stress on that fact. Like, if you are going to signal 15 programs, at least add a paragraph of, at the end, or even whatever, how you want to start those personal statements for those programs. So yeah, thank you about that. Uh, our chair, we have our KEMCAANA chair, YPC, Dr. Hafiz Hassan. He and I, we already discussed about all of these questions, but we're going to ask all the panel. So I would like to invite him, and if he can share his 2 cents.
Thank you so much, Usman. So I have been mentoring few students from KE for a long time now, 5, 6 years, and then I'm also in the faculty, so I interview people too. Um, it rarely helps, as Dr. Elahi said, but it can hurt you very often. So you have to be very cautious. Make sure you give it read it again, read it again. The way I wrote my personal statement, the first personal statement was I saw my grandfather struggling with MI and all that. But then I showed it to my mentor and he told me just change it completely and do what your heart says. So then I wrote a very radical statement starting like growing up in my family, I had no option. Either I have to go be an engineer or a doctor, you know, and my brother and my father was engineers, so I have to be a black sheep. So I choose being a doctor, you know. And once I come to the medical school, that's when I started actually liking being a doctor, you know, after interacting with the patients, after idealizing few attendings who were really good with the patients. So that's how I wrote my radical personal statement. And most of the program directors actually started, just like Dr. Irfan Muri said, the hook statement, probably that was a hook statement. So all of my interviews basically started from that personal statement. Actually, in Brookdale, they actually offered me pre-match just looking at my personal statement. So it rarely helps, but when it helps, it makes a difference. But make sure there's no grammatical mistakes for sure. One question from the panel is when my junior girls send me the personal statements, more than 80% start with I'm coming from a family where education for the females is not very welcomed. You know, I always tell them to change it. Pakistani culture has changed significantly. So I haven't seen anybody in the Pakistani families who actually tells their daughter not to study. You know, everybody wants their daughter to be doctor. So I think it's kind of a lie now. The things has changed significantly. So do you think it's a good idea to start the personal statement, especially for girls, to be like that, or they have to be real, just like men? Dr. Amna, what do you
Yeah.
think?
I feel like I agree with you. Like the times have changed and people have read this here over and over. So I think it has to be personalized. We cannot be generic. And the other thing you said about, and I want to mention that is like avoid grammatical mistakes. And as far as AI is concerned, I want to add here as well that you can use AI to, maybe tailor it, but do not make AI to write it. So then there is no difference here as a female applicant or a male applicant. Do not like try to play women card here. It's not going to help you. So I was married and I forgot, and then I had like so many social challenges, and now I want to be come back to the US system. It's not gonna. You really have to come up with something more original and not more generic, because all of us like females, even in the US grads, everybody have some kind of issues in that respect. So do not like use this like a female card that is going to help you to get interview or residency. So I feel like it's the same for males and female applicants. Thank you.
Thank you very much. That's really helpful. So I'm just gonna leave it open to all the panelists for the next 5 minutes regarding the personal statement, if you have any other opinions, advices that you would like to share for the applicants.
One thing I would like to say is start writing, especially at this time. Like if you have not already started writing, do not wait for the ideas to come or wait for some motivation to start. Just start, put your pen to the paper. That's my advice for now. Start writing whatever comes to your mind. It doesn't have to be perfect, but you have to write something. Once you start writing, more ideas will flow, and then you can keep improving, keep sending drafts out for the revisions as well. Just don't waste your time.
Okay, thank you. So that will be almost concluding our personal statement time. So I'm just gonna briefly touch on all of these things what our all of our esteemed panelists have mentioned today. The big thing is to start writing as soon as possible so that by the end of September you have some things and then you can go over it. And as Dr. Khan mentioned, always have an idea of how many words you need at the end, probably 600, 500, 550. 550 to 600 is a decent number, and then making sure that it's coming up on only one page of your ERAS application. Shouldn't be going over 1.5 or 2 pages. Then trying to avoid the stereotypes, trying to avoid the disease concerns coming from the village things, and then especially for our female colleagues, trying to avoid the playing the, as Dr. Qureshi mentioned about the woman card and all of those things. I didn't say that. Making sure. So all of those things, that's a couple of things that we mentioned. And then obviously, then always we get the question like, how many stories do we have after that? Last year I reviewed and I asked that person that I'm going to mention about that, a personal statement from one of my class fellows who applied last year. And all of his personal statement was about music. 1.5 I would say like whole personal statement was about music and things and all of that. And at one point this year I was thinking of applying for a fellowship, and I texted him like, can I take that idea? And he was like, yeah, sure, I matched. Like that was a totally different personal statement. Another of my junior, he wrote about soccer. All of his personal statement was about football. So like, and it would make sense if you're going to like review 10 personal statements and one of those is totally different. I think I would take that. And other thing, as Dr. Hafiz and Dr. Khan mentioned, is like you should have like 3 to 4 people. That should be enough for reviewing your personal statements. If you have different cooks, more than 5, 10 people, everyone would have different ideas. And at the end, someone would be like, remove this line, someone would be like, keep this line. And you'd be confused what to do, what not to do. So try to identify 2 or 3 people, 2 or 3 mentors. Three should be enough. That that I'm gonna ask for your help during this whole match season, for especially for my personal student. Whatever they tell you, you should follow that. So that's like how we're going to conclude this. We'll have like 5 to 10 minutes for the questions before starting our ERAS CVs question. So if any applicant has any burning question right now regarding personal statement, you are more than welcome to ask. Or if you just want to write it in the chat box, that's also fine. But we're going to start about the ERAS application in like about 5 minutes. So
Usman,
now is your
there are a
time.
few questions popping up in the chat. If you'd like to take those, I think there's a
Uh,
question from Dr. Fatma Khan.
yes, I think they're about the ERAS application,
That's
Dr.
applicant.
Munir. So yeah, so we can.
Answer.
Yeah, Abdullah, go ahead.
Hello, good morning, everyone. First of all, thank you for arranging this informative session for us. My name is Abdullah. I'm a graduate of KEMU 2023. So my question in personal statement is regarding uh, like if I'm interested in a particular subspecialty, should I like mention it in my statement for internal medicine? Like if I'm interested in cardiology, can I give it a hint to the PDs? Like, do they like this or is it considered a negative sign?
Do you
I
want
think
me to answer it? Or
it doesn't go this way or that way. But I think the most important context which I found from the discussion so far was one where Dr. Hafiz said, do not put anything which is going to hurt you. And second thing is, uh, personal statement should reflect who you are in your own words and be simplistic. It does make a difference, but not a hell of a difference. So, but do not do anything. People are not even going to remember what you put down. So I think those kind of things are not going to matter a lot. I like Dr. Josefa's the way he summarized that slowly build it up and your own ideas. And you all have to understand that when you're appearing in an interview, it's not only that you want the residency, but the program directors and the faculty want to make sure that they get filled. They don't go unmatched. So there's a reverse psyche there. So the paragraph to convince them why you want to be here and why do you like this program, you want to be in this area, not only in the personal statement, but when it comes to interviews. So try to express those out. So putting down what specialty do you want to do, it doesn't go either this way or that way. It's up to you. If there's enough room to accommodate that, that's fine. But it's not a big decision changer.
Thank you so much, Dr. Munir. I really appreciate it, and I will keep that in mind.
Sure.
Thank you. I think Dr. Hafiz wanted to add on the same question.
Hafiz, I think you're on mute. Hafiz, you got mute pressed. Hafiz, you're still mute. Osama, can you unmute him?
Oh yeah,
Yes, thank you. Sorry, Abdullah, what was the question?
it's about if someone really wants to do cardiology, should he be mentioning all of those things in the personal statement, especially worrying that there could be community programs who might not have those fellowships.
Hmm. It's a good question. It basically depends how can you defend it, you know? If you say, yeah, that's where my heart is, but first of all, I want to be a very good resident, you know? I want to see all the specialties. I want to rotate in GI. I want to rotate in hemonc. When I rotated back in Pakistan, I like cardiology more, but I'm open to it. But if I have to pick one at the moment, probably I will go for cardiology. But again, people change their mind all the time, and I'm open to looking for more opportunities. So, my only priority will be to be the best resident in the program. That's my first priority. Yes, cardiology comes second. Maybe cardiology, maybe GI, who knows? But as long as you can defend it, you cannot just say that. So the next question program director is going to ask you, so if you like cardiology that much, we don't have any in-house cardiology, so that means you're not going to rank us. But again, it doesn't matter what you say, but it matters how you defend what you say.
Yes, thank you. And one of the questions that I had for Dr. Qureshi and Dr. Ilahi, and I think someone I must have missed that asking this: if someone has a red flag, especially red flag being tell that if someone has an attempt on their exam, step one, step two, step three, or if someone has any kind of detentions or supplies probably back in their med school or things like that, or someone is an old grad, should that thing should be, we should be addressing those things our personal statement, or we should just keep it for the interview? Like if I'm applying as an old grad who might have a step one attempt, should I talk about that in my personal statement to make sure that that's not being neglected?
Again, it's a personal thing, will vary from PD to PD. For me, if you failed, you should mention that. Otherwise, I'm not going to call you. I don't care about your supply and detention. I got so many in my life. That's fine. But if you're failed in CK or step three or something, most of the time, most of the programs don't interview people who have attempts. It's so competitive these days. So if you want, if you think you can defend that and there was a genuine reason, I would put 2 3 lines, not like a whole paragraph, but just to give them an idea that I have an explanation for all this. It's again my personal opinion. If I see some attempt in USML, yeah, I'm not gonna call them for interview unless there's a big reason behind it.
Okay, thank you.
Thank you.
Hasib, you can go ahead with your question.
Hi, am I audible?
Yeah,
Thank you so much for arranging this session. So my question is that it is suggested that we should personalize our personal statement last paragraphs according to the programs that we are signaling. So I wanted to ask that what can we mention in that paragraph? How can we personalize it?
I think probably as Dr. Hassan Ilyas had mentioned previously, like first of all, obviously the reason for signaling that program. If you have been to that area, you can mention about that. If you have done a rotation there, observership, if you know that there are some people there who you have worked on research projects, any connection, any concern that you have, and that's why probably you are signaling that program. You won't be just blindly signaling, not signaling any program. So mentioning about that thing, then if you have done a rotation in that state, sometime I mentioned that I remember like I mentioned a program in Philly, like I just stayed there with a senior for like 5 days. I didn't do any rotation, and I just mentioned that I like Philly. This is good in Philly, and I did this. I went to Rocky Stadium, and I put all of that into the last paragraph of my application on that personal statement for signaling that specific program. So obviously, it's going to be different to different for the program that you have to that you are signaling. But I'll really invite all the opinions from all the panelists about this.
Okay. Well, I think this we should rather open this for a little bit discussion from the applicants. Awais, are you here? Muhammad Awais, Dr. Awais, who just rotated with me. Dr. Awais, are you attending?
Uh,
No, he's not here. Alina, are you there?
I am here. I am here.
Go ahead. Can you please respond to that uh, question? How would you indicate in the personal statement which will drive attention of that particular program's faculty that probably you might be interested in that program?
I think according to me, if you want to convey your message to the program that you are interested in, then I think it should be aligning with your whole personal statement. It's like why you want to come to that program. For me, I am rotating like here in the park view like more than 1 month, so I can align it in this way, like why I choose this program, why I'm rotating extra here, and by living here in the Fort Wayne, how like I like the community here. I am going to most of the time there to play the pickleball, and how is the like weather here, and how are the people here, are they friendly, and how the community likes the people here. So I think by putting this only for the park view, I think this is a good reason. And again, it should be aligning with you with all your goals. Like uh, you started with some hooky paragraph, like with the eye-catching paragraph, and other things like why you want internal medicine. I think it should align with this.
Yeah, thanks, Awais. So I
Thank
just
you.
want to chime in on that. So in general, to sum it up, I mean, the applicants have to come up with something which is catchy, and you're all smart enough to do that. And there's no set script for that, but you have to come up on your own, think about it, and come up with a nice paragraph. I mean, you're all very smart, and you can all be innovative in that. So. If there's any other comments on that, Dr. Elahi, Dr. Hafiz, or anybody wants to pitch in there?
I think with this much competition these days, there are like two kind of candidates in my mind. One you want to take and you're not sure if they're gonna come to you or not. The other one is who wants to come and you just have to decide should I take him or not. So personal statement, last paragraph may change the one for the later. But if, for example, I have Huzaifa Khan applying, I'm going to take him regardless. It's just him deciding if he's going to come to me or not. And that what I'm going to find out in the interview, that if he's really interested or not. I know he has big research all about cardiology. I already know he's going to do cardiology. I have a community program. Can I still take him, or will he rank me first? That's the question I need to answer when I'm doing his interview. Some of them are brilliant, and some of them are the one which need the push. And those for those people, actually, personal statement matters most.
Okay, sounds great. And Dr. Lai, would you like to comment on one more thing, which I uh, have typically seen? Because I work with a community program as well, and they have more inclination towards picking those candidates which they feel that after they get trained, either they are going to practice in the same community as an internist, or they may be connected with the hospital system where they got trained. And a lot of programs, community programs especially, are ranking those uh, candidates preferably, as opposed to if somebody's talking about a lot towards a fellowship or specialty interest.
I think again it's an individual decision, or sometimes the corporate people give you some guideline that hey, this area needs some PCPs. But when I interview everybody, well, I would say 99% of the people say, "Oh, I want to be a PCP." And I can see from their CV, they're not going to be PCP. They have good research in cardiology, nephrology, or pulmonary critical care, or GI. They're not going to be PCPs. I mean, I'm smart enough to know. So to me, as a PD, I'll be proud if I get all my people get into fellowships. So for me it doesn't matter. I mean, if you want to be doing some fellowship later on, that's fine. But as you mentioned, that's right. There is some pressure to fill up the spots for people who would stay in the area. But everybody on the interview will say they'll stay in the area. So I don't know how you can,
Correct.
differentiate.
Thanks for
Uh,
commenting on it. Thank you.
Thank you.
Thank you. Uh, with the time being, I'm just going to ask a couple of questions about the ERAS application that we get every year. And one of that question is about obviously choosing your three meaningful experiences. And I would really want Dr. Ilahi, Dr. Hafiz, and we have Dr. Jalal with us about that, to give their insights on that question. We have, as applicants, they have to choose three meaningful experiences. Should they be choosing an experience from Pakistan? This is a question that we get every year. Like, like I did, people will be telling us like we come here, we work for 5 months, 4 months. All of those meaningful experiences should be from the US, or they can pick an experience from Pakistan. And the second was, if they did an internship house job, should that be being mentioned as a meaningful experience?
I think I'll keep it simple. Yes, you can use Pakistan experience and the meaningful experience for sure. And another thing I want to mention, that please do not say that the house job was bad or we didn't have facility. Uh, Pakistan, fellowships are good. So keep it that way. And yes, any meaningful experience should not be only from America. But if there is one from America, let's put it on. If I'm doing it, I'll at least put one from America.
Okay,
Thank you.
thank you. And the second question was about obviously putting something about volunteership on any work. And most of us like have the same societies. Like if I have to see 10 applicants, everyone must have mentioned about Student Patient Welfare Society, or any dramatic society, debating society, or working for COVID, or working in floods. So do you keep that as a better option? Or if I am someone is rotating here in the US, if they did any volunteer work, now that they can't do for a month, like because they'll be rotating. If they have done like for 1 day, 2 day, 3 things, 3 day work in any volunteer here in the US, would that be of a more points than just working in putting that Pakistan experience in the CV?
I think anything which is more powerful and strong. For example, if you did a flood relief campaign in Pakistan, that's more stronger than going here and checking blood pressures. Again, it's for me, it will touch my heart more versus if you did something here. But yeah, even if during rotations here, you can mention that you went with your faculty for like a church, blood pressure monitoring or glucose monitoring. That's something, if that was a meaningful experience for you. And for voluntary experience and all that, it's very important, because I see so many times during an interview when I ask them, do you have any questions? The question they have, oh, do you have any opportunities to work in the community? I'm really fond of working for the community, but their CV has zero community work. So if you're asking that question, make sure your CV has something already done in your life. Otherwise, it looks like you're just lying.
Yeah,
Or thank you.
I agree on that. Thank you. And I'm just going to ask Dr. Irfan Munir and Dr. Hafiz. Another question was about the US experiences too. And also for Dr. Eli to mention about that. If I'm coming as an applicant from Pakistan, uh, I I'll either do electives or either do observerships or externships. And people always ask, should they just focus on IMG friendly programs, or do they need to go to places like Cleveland, Harvard, Mayo, where obviously they'll be exploiting, they're charging like thousands of dollars per 1 week or 2 weeks observership. Like uh, how much the program directors and faculty who are reviewing the applicants, do they see towards just that specific experience, like if someone is doing a rotation at Mayo or Harvard, or if someone did a really good rotation with a good LOR at an IMG friendly program or a community program, would that matter more?
Okay, so as far as the observership, thanks for bringing up that question. So try to keep the cost of gaining experience minimum. If you're going to spend something to gain experience, rather invest in doing some research where you can get a good publication. I would not invest revenue in doing observerships, number one. Number two, in observership, it has become a norm in United States that you have to have 3 months of United States clinical experience. What I find, so my career spans almost 35 years. So when I started, the people who were coming from Pakistan, they were lacking in the know-how of Western system. Now the graduates who are coming to United States because of information technology, because of social media, they're very apt with what's happening in the United States. So how much observership imparts to you grooming or growth? Some, but not a lot. So in observership, what all the candidates, what you got to do and what I try to teach, not medical literature or medical evidence-based research or that kind of stuff. I try to teach all the observer how to carry yourself, how to manage yourself, how to manage your life. And that's what's going to make or break you to be successful or not to be successful. Because literature is there, research is there, opportunities are there. But you have to train yourself in a way that you carry yourself well and you function yourself well in a system. And in observership, do it any way you can get with a minimum cost. Don't invest on it. If you want to invest on something, if you have resources, invest doing a research at a place where you can get published with a good name. That always counts, not only for residency, but later on if you want to go for fellowship as well. So that's my 2 cents on it.
Thank you, Dr. Munir.
Yeah. Can you hear me?
Yes.
So I totally agree with Dr. Ilahi and Dr. Irfan Munir. It doesn't matter where did you get the experience. It matter how impactful the experience was. You know, if it made you a better person, whether it was in Bronx, Lebanon or not, for me, that's more important than going to the Harvard and getting ready and just going there and coming out and writing just one line about it that I went to Harvard, because it didn't change you at all. So I totally agree with Dr. Irfan Murray that it's all about the impact, how it impacted you, how it made you a better person, better physician. That means more rather than just attaching a big name there.
Thank you. And
And
just coming,
one more
yeah.
point, Hafiz, thank you, Hafiz. The word with Hafiz used was the impact, and an impact value of the observer should observership should be how to function well in the medical system. And there's small points which you're going to pick from each observer, and there would be several. How do they interact with the peers? How do they interact with the patient? How does he greet the patient? Does he always talk about, do you have any chest pain, or he start conversation by talking about his some other interest about American football or something like that? So these are the things which you need to learn, which you need to invest your time on. Baki, to have when we talk about like medical questions and how to do research, there's enough time for it, and life is open for you for doing that. So.
Um, yeah, I also saw a pattern when I review the personal statements from American graduates. They always mention some leadership experience, Starbucks experience, photography experience, cooking classes experience, things like that, which make them a versatile person. At the end of the day, I want to hire people who are, well, nice people to interact with. They have something else to talk about rather than just medicine. So whoever rotates with me during observership, I always tell them to add some extracurricular experiences too. So that's my 2 cents.
Thank you. And as Dr. Munir was mentioning about research, and that's also a very hot topic these days. So I remember when we applied 2 3 years ago, we were told by our seniors in Lahore that you should have a minimum of five number of publications. It could be anything that you should have to mentioned in your CV. Now, being research being more, especially there's a lot of culture of posting. Publishing a lot of abstracts, and that's especially for Dr. Hafiz and Dr. Ilahi. Like, what would you recommend to the applicants? Is there a dedicated number of research work that they should have when they're applying for application, or are you looking at a specific, if it's a full length paper, if it's an abstract, or if the people are going to publish and present at any conferences? Would that be a better thing than just publishing a lot of abstracts?
I think for me, quality matters. So if it's a manuscript, it will matter. They're like people have 30, 40 abstracts. I mean, I don't know what to do with them. And again, if you actually present it in a conference, like a big national conference, that's a big impact. That gives me an idea, oh, this guy is confident, he can do it. And then, if there's a full manuscript published in a good journal, yeah. If you have like some publication, I mean, I've never seen one, but if it's a NEGM publication, you're gonna be ranked for sure. But most of the good publications, people really want to take them because nowadays everybody is rating the program based on how much publications they have. So I try my best to get more research in the program, who can do research and work along with the faculty, because faculty is very busy these days. Most of the programs don't have their own faculty. Like community programs are not based on, okay, you hire a faculty. Actually, community programs is based on there's a private faculty and you tell them, hey, can you be our faculty? Those guys don't have time. They have the mind, but they need somebody to work along with them to do some research. So that's why research is important. Yes. And
Excellent point, Dr. Elahi. I'll comment in and sort of what I've seen over the last 4 or 5 years. The most of graduates who are coming from King Edward, they're very good in writing manuscript and
yeah,
collecting data and doing research. So I'm trying to get people involved in doing projects. And when they're rotating here, I try to get them be visible, teaching other residents while they're being observer how to write manuscript, how to do research, and that really worked like a magic. Any
that's
any observer who had done that, he was selected. So,
yeah.
so I think we will need to sort of work on it a little bit with people who are providing observership to try to get them, people who come in, get them involved with the local residents to get into research projects, which certainly increase their chances as well. So,
Yeah, that's good. Thank you.
Thank you.
Also, regarding the observerships, yeah, I mean, I see Harvard, Yale. I don't think it has a big impact. As for me, if you're done in a nice community place with more impact, you've learned more. Because when I ask questions, they have no idea how US system works. they don't know what is a case manager, why a social worker is important, how a medrec is performed, or how a patient is, discharged or dispositioned, or what is a skilled nursing facility, all that. So for internal medicine, these things are important. If you've done a rotation and you're not aware of all those things, and you haven't learned that how to interact with nurses, how to interact with pharmacy, when do you call pharmacy, all those things you should learn in this medical questions. Is not the It's not the time to learn medicine when you're rotating. It's the time to learn how the system works here. So I don't know, Yale or Harvard are providing all that, knowledge. If you're working with a transplant hepatologist or nephrologist in Yale, I don't know if they're gonna be any useful to you.
So,
Thank you.
so just to give you background, I did my internal medicine at Yale, and my interview with the program director was that he simply told me that Dr. Munir, people who don't take care of themselves are not very liked in this program. So the simply don't bother us, don't take care of patients.
That's a good
Thank you.
one.
Thank you. Yeah, so I think we're almost into 1 hour. So that's going to be pretty much about today. We are